Hey guys, welcome back to my channel. My name is Brindice if you were new here. Today I'm going to be telling you guys a very big, important part of my life, and that is my Crohn's disease story and my diagnosis. So I've gotten a lot of requests about my Crohn's disease story and like how I knew, my symptoms, my surgery, and all that kind of stuff. So I thought I would just do a video for you guys and explain everything that happened to me. And I also wanted to address this now because of everything going on in the world. Crohn's disease is an autoimmune disease, so I am high risk for this virus going around right now. So make sure to wash your hands, stay clean, stay inside, check up on your loved ones, and stay healthy. And make sure if you haven't subscribed yet, make sure to hit that subscribe button down below and turn on my bell notifications so you get notified when I upload. And moving on to my Crohn's disease story. I was diagnosed in June 2014. That was not the first time I ever had symptoms though. So for symptoms, I had two different times in my life when I had symptoms. The first time I was in the 6th grade, I was 11 years old, and I had severe abdomen pain. So they thought maybe it's her appendix because it was on my lower right side of my stomach. It was very painful. So we went to the ER and they just sent me home with antibiotics. I ended up going twice during that time and I just got antibiotics both times. That was that. So moving a few years forward, I have a notebook here of notes because I can't remember my own story. Okay, in 9th grade, this is when everything kind of happened. I got diagnosed, I had surgeries, all that kind of stuff. 9th grade, my symptoms were abdomen pain, cramping, bloating, constipation, diarrhea, blood in my stool, fatigued, no appetite, nausea, and overall I just did not feel good at all. So those were all of my symptoms. I developed all of these symptoms in 3 years. When I was in 9th grade and all of this was happening and I went to the doctor finally, we just knew something was up. Something was wrong. I was not okay. When we went to the urgent care, they took a blood test and I got a CT scan. So the blood test showed my white blood cell count and my inflammation levels were so high. So I got a CT scan and what they saw in that was nothing. They couldn't see because of the inflammation and all of that. At the time, they thought my appendix had ruptured. You couldn't see anything, my white blood cell count, all of that. So they're like, oh, her appendix ruptured. No. So the next day I go in for a very urgent appendectomy, and that is when you get your appendix removed. And this surgery is microscopic surgery, so they have a few tiny incisions in your stomach and then they blow it up with air and they use a camera to do the surgery, so they don't have to give you like a huge open stomach surgery. So when my surgeon started the surgery, he soon realized that it was not my appendix and something else was going on. So this surgery was like 2 hours long or something, and what he did, he hosed my insides out. He like tried to get some of the infection out and he just tried to help me a little bit because he knew something was very wrong. So then he closed me back up and I had a tube hanging out of me while I was recovering in the hospital, like draining all my fluids, and it was so gross. And then when they had to pull it out, it hurt kind of, but it just felt super weird getting that tube taken out. Anyway, so after that surgery, I wasn't diagnosed with anything. They're like, what's wrong with her? Like no one knew what was wrong with me. I recover from that surgery. I take like 2 weeks more from school and then I'm back at school, so week 3, and I'm in PE and I just had surgery, so I could not work out. I was sitting in the bleachers waiting for class to be over. When class was over, I went to go stand up and I immediately dropped to the floor. I had the worst pain I have ever felt. So this pain was worse than my surgery I just had. So keep that in mind. It was very painful. I turned like white. I was pale and sweating, and it was like March or April, so it was not very hot outside. My teacher at the time, he had to call 911 and the paramedics came. I was stuck in the fetal position because the pain was just so bad I couldn't like let go of my body, So I was just like holding on to myself, like crying. And this was in front of my whole entire PE class. So it was pretty embarrassing, honestly, being so vulnerable in front of all of your peers. The paramedics came to my high school bleachers and they had to use this stair gurney to get me down because I couldn't walk. They couldn't like carry me down because I was stuck. They had to pick me up in the fetal position, put me on the gurney, and so they could get me down the stairs. Obviously you can't stay still completely when that happens, so then it was just very painful. Every time they went down a stair, it hurt so bad because it was like thump, 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 and it was like so painful. So on that day after that pain subsided, I got an appointment with a GI specialist over at Children's Hospital for like the next day or a couple days after that. We get to my doctor's appointment and I meet the doctor, and basically he's just like asking me all my symptoms and all of that. He decided to admit me into the hospital for pain control and just to watch and make sure I'm okay. I was in the hospital for I think like a week or 10 days at that time, and I got released. I went home. A few days later I was admitted again into the hospital for pain control and just to be watched to make sure I was okay and healthy. At this point in time, the doctors definitely want to do another surgery, but you have to wait 6 weeks in between 2 surgeries. I was at like week 4.5 or something. I just had to stay in the hospital until I could have surgery. And during my hospital stays, 90% of the stay, I wasn't able to eat. I got very weak. I lost a lot of weight. I just looked really like fragile and sick basically. The time comes and I can finally get this other surgery. This is called an ileectomy. Basically what they did is they removed, I think it was like either 14 or 24 inches of my intestine and colon. So since I'm tall, the doctor was like, good thing you're tall. They were able to remove the whole entire area that was infected. And that isn't always the case for people, but fortunately it was the case for me. Before I had surgery, I had to have a colonoscopy and endoscopy. And I know it's kind of crazy, someone my age having to get a colonoscopy, because usually people only think of like older people getting them. I was actually 14 years old getting a colonoscopy, and I was very scared to get that procedure done because it is embarrassing, it is uncomfortable. You are asleep during it, at least I was, because I was at Children's Hospital, and that's what I knew they needed to do to see what was going on with me. So the colonoscopy is a camera up your colon to see your whole GI tract, and endoscopy is a camera down your throat, which they discovered I actually have scarring in my stomach lining as well as the big area on my lower right abdomen. I had 2 places with infection, and I never actually had surgery on my stomach because the infection wasn't that bad, the scarring wasn't that bad, so they didn't need to remove it or do any surgery on that. So I still do have a little bit of scarring and stuff in my stomach. It doesn't affect me that bad. I can manage it pretty well. The surgery is done. It took like 7 hours. I was obviously asleep for the big surgery, and they removed 14 or 24 inches of my intestines and colon and my appendix and my gallbladder because they were both inflamed from all the inflammation from my Crohn's disease, so they just removed it all. So this is the only like horror story I have from being in the hospital. It is the day I woke up after my surgery, and so I was very fresh, raw, and I still hadn't really been like clear-headed at that point yet because I was getting off of anesthesia and I had morphine and pain pills. This morning was like the first time I was like, whoa, I just had surgery. I'm in the hospital again. At most hospitals, at least Children's Hospital, every morning they do something called rounds, and it's all of the big doctors, all the big guys in the department come to your room and just explain what is going on, why you're in the hospital, what the plan is. At this time, I was in the room with the doctors, like not even able to really speak yet. This doctor comes over to me, lifts up my gown, doesn't even ask me for one. He rips off this bandage where they cut me open. I started screaming. I was hyperventilating. When you have surgery, especially on your upper body, it gets really hard to breathe, and they actually have to work with your breathing while you're in the hospital to make sure you're breathing correctly and make sure your oxygen is okay. And this is just day 1 out of surgery, so I was not breathing very well for one, and this doctor rips off my bandage, makes me start hyperventilating. I'm like holding on to the hospital bed trying to breathe, and I was like freaking out because I couldn't move or breathe because I was in pain. So it was just an awful time, and this doctor got his head chewed off from my dad because my dad was furious. It was just a very awful situation. That was my only bad experience in the hospital, but thankfully the situation was taken care of, it was handled. But moving on, when I was recovering, it was really hard. I had to start walking in the hospital. Walking was very hard. My core muscles were just like done. I had none. I was very weak. When I was recovering, I was pretty much in bed most of the time, just with some pain medicine because I was in a lot of lot of pain. It probably took me a full another week after I left the hospital to feel better. Not completely better, but I was kind of myself again. I wasn't taking as much pain medicine. I didn't have to rely on people to like help me get out of bed. So I was diagnosed in June while I was in the hospital because they have to do surgery to diagnose you, I guess. It's just really hard to be diagnosed with Crohn's disease. I was finally diagnosed after surgery. So moving on to post getting diagnosed. So I'm 15 at the time. I have no idea what Crohn's disease is. Everyone at my school thinks I had my appendix removed. It is just like such a crazy time and confusing time in my life. And I'm like 15. I'm not worrying about my health, about my body. I'm worrying about boys, my friends. Like, I don't care about my body, about my health. That is not my priority. I didn't realize at the time what you did to your body, what you put into your body, what you exposed your body to affected your body. I was not taking very good care of myself at all, and throughout high school I had a few flare-ups. I was on the medication Humira at the time after I got diagnosed. So this medication, a shot, it was like an injectable, and you do it at home. So every week I'd have to ice my leg or my arm for like 30 to 45 minutes to numb it, and then my dad would have to give me a shot, and it hurt so bad. It just like honestly really ruined my day. I would dread it every single time it came around. So while I was on that medication, I did have 3 or 4 flare-ups, and I missed a lot of school. I missed out on a lot of things. I was not very healthy. I was not doing well. My senior year of high school, I developed an allergic reaction to this medication. I just started not being able to breathe. It was the day after I had my medication, so it was the only logical explanation to why I was getting an anaphylactic reaction. I get off that medication and I get on Remicade. Remicade is my medication, and I get it every 8 weeks, and it just helps control my inflammation and all of my Crohn's symptoms. This infusion is through the IV, so I either go to an infusion center, or I went to a children's hospital for a long time, or someone can come to my home. That's how I get my medicine now. So I got on that my senior year, but I soon developed psoriasis and joint pain. But that infusion gives me psoriasis on my scalp, and I also get it on my body sometimes, but I don't have that right now. So the joint pain happened very fast, and I didn't really understand what was going on. The first time I ever had joint pain, I was sitting in my friend's bed and we were just hanging out doing homework. My elbow just started hurting so bad and I couldn't move it. And I was trying to get out of her bed and I couldn't push myself up to get off the bed. And the following day, so I was in high school and I was in choir. We had this big, huge choir thing going on, and it was very important. And I remember waking up and my body just hurt so bad. And I had no idea why. And throughout the day, a different limb would start hurting and like not be able to work. So it started with my elbows, and then it turned into my knees, and then my hands, and then my ankles and my hips. So from morning till the end of school, like 3 o'clock, I could hardly drive home. I was driving like with my forearms, and this was the first time I ever experienced this. So I had no idea what was even going on. I hadn't even researched, like, does Remicade have joint pain side effects? I get home and I'm like trying to figure out what's going on with me. I finally figure out joint pain is a huge side effect of Remicade. I had to have my friend call my work and call out for me, and I just kind of sat there like, what do I do? And that was very awful, but fortunately now I do not experience joint pain like that at all. It's very, very, very minor now, and my psoriasis is taken care of, so fortunately both of the side effects from the infusion are gone now, so I'm happy about that. I got my medical card so I can consume medical marijuana. So medical marijuana has huge benefits for IBD, Crohn's disease, colitis, so many more things. I'm not going to go too in depth with that aspect, but I will link some articles down below if you want to read up on it for yourself. So I use THC and CBD for my pain control, for my inflammation levels, and currently the last 3 years, I struggle with having a lack of appetite. Some days I just can't feel hungry. My stomach will be growling. I hadn't eaten all day, but I don't feel hungry, and I get nauseous just thinking about food because I'm not hungry. With that happening, that is not a way to live, and I was also trying to work out and be healthy at this time, so I needed to eat food every single day. I started to use THC to help me eat. It really, really helped me a lot. At the time when I first got my medical card, I was having this severe joint pain, and that is the only thing that ever helped me. Just know I'm in the state of Washington. I am completely legal to consume this because of my disease and my medical card. I'm not going to address medical marijuana that much because it's such a touchy subject, but I will link some articles down below if you want to read up on it. So the THC would help me eat, and I really relied on that for eating and pain control and my inflammation levels as well, on top of the Remicade. So that is currently what I'm doing right now for medicine, is Remicade and medical marijuana. I'm doing great right now. I'm technically in remission, I would say. The only time I ever have issues is if I eat dairy or things I know I can't eat, or if I am really stressed out or have bad anxiety, I tend to get some more symptoms. That is currently where I'm at right now. I feel great. I'm healthy. I saw a lot of comments on my weight loss journey about people having Crohn's disease or IBD, so comment down below if you have any of those as well. I would love to talk with you and we can be friends. That is all for today's video. I hope you guys enjoyed this story and my journey, and if you have any other questions about Crohn's disease or just like my experience with Crohn's disease, comment down below and I will try my best to answer. And make sure to hit that subscribe button down below and turn on the bell notifications, and I will see you guys in my next video. Bye!